Okay, so good afternoon. If you are here in Perth, it is 2 o'clock or just after 2, hopefully 2 minutes past 2, because that will keep with the twos, on the 22nd of the 2nd, 2022. So we're doing a live, basically meeting webinar style for people who want to learn more about what factors they need to know about if you have back pain. So I'm just making sure that I haven't had any messages for today. So thank you so much for joining me. If you do have back pain, I'm hoping that you might learn something today. There might be a little bit of background noise because we are still a working clinic, so you might hear a little bit of babble in the background from people who are coming in and out through our treatment doors. So my name is Suri Hewlett. I'm a musculoskeletal physio, and I've been a physio for, I think, nearly 30 years, so it feels very old when you say it that way. But from a physio point of view, obviously we see a lot of different people, a lot of different clients who have back pain, who have acute back pain, chronic back pain. They might have pelvis pain, they might have upper back pain, and it's one of the things that really people struggle with. If you've had pain in the past, you know, back pain can be quite debilitating. So really, when you're looking at the stats, there's 80% of people who suffer with back pain. And that could be 80% that have had one episode of back pain and that's it. 80% of those will go on to have recurring back pain. So if you've had back pain in the past, you're 8 out of 10 times likely to get recurring back pain or have another episode of back pain. So it's definitely an episode of something that causes a lot of problems for people. It causes a lot of sick days from work, so people are unable to work because their back stops them from working, but it also changes how people can live their lives. So having been a physio for 30 years, obviously over that time, how people manage back pain has changed dramatically. How we look at things and how we look at what people are doing with back pain changes dramatically. And when I say in the early 90s, when I qualified, people were still moving quickly, but there was still that belief from before that I need to go and I need to do bed rest. I need to just wait my time out, and when it's better, I'll get up and I'll move and everything will be fine. And definitely now, certainly recent trends is most people know that if you have back pain, you want to move, you want to exercise, you want to make sure it's strong. However, going from having back pain to moving and getting strong is the little bit of disconnect. So what we see tends to happen, especially in the studio, is that people decide that they want to get stronger, they want to do more, they want to achieve more, and they go from doing nothing and being in pain to try and do boot camp. Or they go from doing nothing and being in pain to try and do gym. And it just doesn't work because your muscles and everything and the way the body moves, it's not ready. There's a few key steps that get missed out. Excuse me, because now I'm supposed to talk. I'm going to have a constant cough and tickle in my throat because I know I'm supposed to talk. So when we're managing people and when we're looking at things, we definitely look at a few things that are a little bit left to the wayside by a lot of people. So if you do have pain, there's a few key things that you need to be aware of that happen in the body. There's a few key things that change over time. So the longer that you've been in pain, things do change and things do alter. But there's also some key things that if you're doing the right things at the right time, then you get the optimum outcome. So we're going to go through a few of those. I've got a few notes because I'm going to try and keep it to about an hour, but it's a very passionate topic, so I'm likely to go a little bit more than that. So I've got a few key notes that I wanted to make sure that we cover. All right, so what is back pain? Back pain can be a number of different things to a number of different people. When we're looking at the back, obviously you've got the skeleton, you've got your joints, you've got the tissues, you've got the vertebra, and between the vertebrae you've got the discs. On top of all that, you've got the joints that create the join between the two adjacent vertebrae. You've got ligaments, you've got muscle, you've obviously got nerve tissue. When you're thinking about the back itself, there is, let me just go and get the back, so give me 2 ticks because that would have been smart to bring the back with me. So, not a very good teacher trying to teach without visual aid. So we have the spine. It's in a lazy S shape. So if I move back a little bit, you'll see the vertebrae at the top of the spine, obviously a little bit smaller. They allow us to move. They allow us a lot of mobility. We have the next 12 vertebrae, which are your thoracic vertebrae. These are a little bit bigger, and they're in that sort of S shape facing backwards. So as we're moving, they'll be around between your shoulder blades. These have little extensions off the back end, which are a little bit more prominent than the neck vertebra, and that's where our ribs are going to come off and our ribs are going to attach. The purpose of the thoracic vertebra is to allow the ribs to take attachment, and the ribs basically form the protection of our vital organs. So our lungs, our chest, obviously some of our important organs around the liver and the back where the kidneys are encased with the thoracic vertebra, and that relatively is a lot stiffer. So while the neck can move quite well, the upper back, so belly button upwards, that sort of area is relatively a lot more rigid. The lumbar vertebra, so the 1, 2, 3, 4, 5, these ones here, obviously a lot bigger. That's what's holding our vertebra and our upper body in space. They're a lot more load bearing, and they attach onto our sacrum at the back. So the lower joint attaches onto the sacrum attaches at the edge onto each side of the pelvis. Okay, so in terms of the vertebrae themselves, they're all basically the same. The shape and size of them is different. We have the body of the vertebra, we have the disc in between the vertebra. So obviously the vertebra is bony. We have the disc in between, which allows us to move. So it's not just a complete rigid spine. Obviously, can we move forward and back? We can move side to side, and we can do rotation, and we can do a combination of all those movements as well. Between a top and bottom vertebra where the disc is, you'll see there's a little hole. That hole is where your nerve comes out. So the nerve comes out through that hole, and it goes and supplies the legs. So in simplistic terms, the lower 5 vertebrae at the back, they're the ones that if we do have problems and we do have pinching in those areas, we might feel it around through the hip and around through the thighs, the back of the leg, depending on which nerve is being pinched. This little red bit here is just showing what would happen if you have a little bit of a disc bulge. So if a little bit of the disc gets squashed and it squashes outwards and it becomes inflamed, or if there's just a little bit of inflammation around there, if that inflammation and pressure is on that nerve, that's obviously where you feel the pain that goes down the leg. The more pressure here, or the more pressure on the nerve, the further down the leg the pain goes. Just be aware that obviously each of these individual nerves is coming into your spinal cord, and that's then sending messages up to the top, to the brain, to allow you to know that that hurts. Now, when we have these nerves that affect our legs or in the neck, they obviously affect the arms. What's happening here is they are affecting how we move. So we have motor nerves, we have sensory nerves, and that means nerves that give us the strength. So if our muscle that controls the legs is working well and it's not compromised, we have full strength. When our legs feel a bit weak and a bit heavy and we're sort of tripping over ourselves, it could mean that that nerve that's supplying the motor complex is a bit more compromised. If we have pins and needles, it means that one of the sensory nerves is. If we've got changes in our sort of feeling of hard touch compared to feather touch. Also, if we're sort of not aware where our leg is or our arm is in space, it might mean our proprioception perception nerves are a little bit deficient. So what we're looking at when we're looking at nerves is there's lots of different nerves that do lots of different things. So that's a very simplistic look. We have the bones, we have the discs, we have a little bit of a opening between the two discs as they join together. We have the joint here, which is your facet joint, which causes that the joints one above and one below, and obviously that makes and creates a hole that the nerve comes out. Now, anything that can affect that can give you pain. So you can have bony pain, you can have disc pain, you can have nerve pain, you can have joint pain, you can have ligament pain, you can have muscle pain, you can have fascia pain, and you can have a combination of all those pains. So when people are saying like, what's causing my pain, it really is a case of we actually need to look and see and test. You might have on X-ray or on MRI, you might actually have the joints and the spine of a 90-year-old, and you might be pain-free. You might on X-ray have the perfect joints of a 20-year-old and be in agony. So reflectively, when we're looking at radiology, when we're looking at scans and we're looking at results, we also need to be aware, does that reflect what you're coming in and complaining of? So that in a nutshell is what can cause pain in the back. Now, how does back pain occur? So all of those tissues, they're all pain sensitive. So they're all issues or tissues that can generate pain. What you need to be aware of is then how we deal with that. So when we have discomfort, when we have pain, we need to know what area is being affected. Now, if you've had something like trauma, you've fallen over, you've tried to pick something up, you've been in a car crash, you've had something happen that's affected the pain, then obviously it's very easy to sort of say, look, I was doing X, Y, and Z, I fell on my bottom, or, I was in a car crash and I was hit from the side. You've got an area where you've got something a bit like when you roll your ankle, you've got something tangible that you can say, look, there was trauma that occurred, something caused this, something jolted me, something hit me, something broke, something pulled, something twisted, and then you've got pain, okay? The harder bit is when people have nothing that they can think of, and this is what a lot of our clients come in with, is they've had nothing that they can think of, but they've had a little bit of a niggle, and that little bit of a niggle has increased, but then over time it's got worse, and now they're in this constant lot of pain and they don't have a recollection of what they've done. And that's where we sort of see that, what we call insidious back pain, which is basically there's no real reason for it, your back just hurts. And so obviously it's a lot easier to deal with if you've had some trauma. It's a lot harder to deal with when you haven't, and you're just getting pain for the sake of being in pain. So back pain. In the acute stage, so if we split back pain into acute pain and we split it into chronic pain, acute back pain is either you've done that first thing, you've had trauma, or you've had back pain that's, you've twisted funny in bed, or you've gotten up and your back's sore. We'd call acute back pain that's just started up until maybe 6 weeks. So if you've had pain and it's been there around about 6 weeks, you're probably in that acute stage. Now, what happens in acute pain is there's a tangible process that's going on. So if the trauma or the injury, or you've pulled or you've lifted something and something happens, in that sort of acute injury phase, you have a physiological process that goes on in the body. So what happens is you will have an inflammatory response, a bit like when you roll your ankle or you twist your knee, the joint swells up, it's tender to touch, you've knocked it, it hurts. A similar thing happens in the back. So obviously you can't see it because it's deep inside along the spine, but you'll have that acute inflammatory response. So for the first day or two, the back might spasm, it might get stiff, it might hurt. Same thing like when you hold your knee or you hurt your elbow, you basically want to keep it still, you don't want to move it. A similar process is going on in the spine. So within that first 24 to 48 hours, we've got that acute process going on. There's lots of chemical mediators, sort of chemical systems activated in the body. So that chemical response to don't move, you've got pain, we want to keep it still, we don't want to let you move it so it gets worse. So we want you to hold it still, the muscle spasm, and technically the area swells up. You have all this little chemical process going on at the back, and basically the limb or the area swells, the muscle spasm, you don't want to move it, and it hurts. So the initial thing with an acute back pain episode is you want to rest it for the first 24, maybe 48 hours, and then the next phase kicks in, which is again similar to an ankle or a knee. Your next phase is what we call the repair phase. So what's happening now is we've had all the inflammatory response come in for the first 24, 48 hours, and then after that we have the repair phase that happens. So with the repair phase, we're looking at the white cells coming in and they're trying to repair what's going on. So if you've strained a muscle, if you've had a ligament tear, if you've got some inflammation or there's a problem in the disc, they're trying to then repair that and repair that process. So obviously very similar to your ankle or your knee. You then think, okay, I might be able to start moving it, but it hurts in certain directions. You know, with your ankle, you might be able to do that, but it hurts if you try and twist it. Same with the knee, you might not be able to bend it a little bit, but it hurts if you bend it too much. So again, a similar process going on in the spine. Obviously, we just can't see it. So what's happening there is that you're getting over that sort of next 3 weeks, maybe 6 weeks, is that repair phase going on. So if you liken a normal thing to an injury scale, when we're talking about, say, muscle tissue or ligament tissue or damage, we're looking at it on a grade of 1, a grade 2, a grade 3. So if we liken it to your ankle, you roll your ankle a little bit, it's not too bad, it's sort of, you know something's gone on, it's sort of a 0 to 3 weeks time frame maybe. The next phase up is where it's a little bit, you know, you roll it and you know you've done something and you're limping a little bit, but it's not quite too bad. You think, yeah, it's okay, I just need a little bit of time and I'll get over it. That's your 0 to 6 weeks. You roll your ankle really badly and you can't put weight on it. You know it's not broken, what have you, but you know you've done a grade 3 strain, or you know you've done that sort of grade 3 problem where you're going to have to really look after the ligament. You might have torn the ligament, there might be a little bit of issue in there that you need some strapping and some taping, and you really need to protect it and get it moving. So similar things in the spine, you're still going to have that sort of mild to moderate to severe. And that's the difference in what's going on, how long that recovery might take. So your mild is 0 to 3, your moderate is 0 to 6, your more severe is 0 to 12. So about 12 weeks or 3 months. So that will sort of gear in terms of process, that will sort of sit with all the different injuries. So whether it's a ligament, a muscle, a nerve. My nerves tend to be a little bit different, but we can come back to that. But if you're thinking muscle, ligament, disc and bone, it tends to be within 3 months, that sort of injury process, repair process and remodeling process where everything is getting strong is generally a 3-month sort of cycle. Now, in that time, you're getting through inflammatory phase, repair phase, remodeling phase. So you've injured the tissue is trying to repair itself, and then the tissue is trying to get strong. So there's 2, 3 distinct phases that happens in injury. Now, if you liken it to an ankle again, we immobilize it, we don't want to move it. Then we start moving it this way. So if I've got my ankle, if my ankle hurts, I'm going to move it this way. And then when it's ready, I'm going to try and move it side to side. And then I'm going to try walking before I try running. And I'm going to try running in straight lines before I try doing running side to side. So there's a little bit of process that goes through. Same thing will happen when we're doing backs. You want to say, okay, I'm happy here and I'm happy in this position, but I'm not happy in these positions. And we don't tend to have that same process goes on when we're looking at backs, because we're still bending, we're still reaching into cupboards, we're still doing this, we're still doing lots and lots of day-to-day activities. We're not as privy to as much to be looking after our spine, because then we tend to hold everything too rigid, or we tend to be very stiff in our spine. So When you're looking at the spine and how it works, what we want to do is make sure that we're aware what phase we're in and how to manage each phase. Okay, so if you liken it again to an ankle problem, if you can't walk without limping, we're going to give you crutches. We want you to walk as normally as possible. Once you can start to walk normally, we might give you some heel raises. Once you can do heel raises, we might start doing some steps. Once you can do steps, we might do some squats and jumps. And then before we start you running, we're going to make sure that you can jump and hop and skip. That's the sort of process that would happen with ankles. With backs, people tend to think it's sore and then it stops hurting, so I'm just going to go back to normal. And they can kind of miss out this whole sort of central phase of you're here and your back's been a problem and you go back to normal. And they miss out the little bits along the way of how to then make the back stronger or how to make sure the back is stronger before it gets sore again or before, you know, they go back to normal activity. So we definitely have a lot of clients who are like, my back's sore, just fix me. Like, yeah, well, we can fix the pain and we can fix everything else, but you've still got to be aware that at the moment you're in this phase and you're trying to make your back go back to normal here. You might be wanting to play squash, you might be wanting to run, you might be wanting to cycle, you might be wanting to swim, you might be wanting to do, you know, triathlons or whatever else it is, but your body's still healing, even though it doesn't feel the pain. So that's one thing to be aware of when you have an acute problem. Now, what happens in the chronic side of it is we have your inflammatory process, we have your repair, and we have the remodeling. But if people never quite leave that sort of loop of inflammation repair, you keep getting that sort of feedback loop that everything keeps hurting. So you're still getting that sort of messages that keep going up and down to the brain saying this hurts, this hurts, this hurts. But you're not in an active phase of anything anymore. So there's no active inflammation going on, there's no active repair going on, there's no active anything going on, but the tissues are still recognizing that you're in pain. And this is where we sort of fall into that chronic pain situation, which happens after 12 weeks or so. So once you're in acute, which is 0 to 3, maybe 0 to 6, then we're into subacute, and then after 12 weeks, we're into what we call chronic. So a lot of back pain is just self-limiting. After 3 months, you sort of pretty much, the process is over, the healing process is over, and after that, we head into the chronic ongoing phase. And if you're still in pain and haven't really changed and you're still in pain on that sort of 3 months plus without a new injury occurring, you might be doing one of two things, which is irritating it or re-damaging it without realizing, or you're in that chronic loop, chronic pain pathway sequence. So that's the bit where we see the majority of our clients. They've, you know, potentially been in chronic pain for a long time. They might have had an episode of pain, and this is the sort of 80% that go on to get recurring pain. You might have pain where you've hurt yourself, and a little bit like a weak ankle, if it hasn't been rehabilitated properly or you haven't got it stronger properly, then it's easier for you to re-injure because there's a little bit here that's not quite as strong as it was before. So you might find that you hurt yourself and it's taken you, you know, 6 weeks, 12 weeks, and it feels okay, or you might have gotten over it really quickly, and then something minor might happen and it hurts again. And this time it might take you a week or 2 weeks to get over it. And then instead of another year going by, you might find that 6 months has gone by, but this time it's taking you 2 to 3 weeks. Then you might get another episode after 3 months and it's taking you a month or longer to get over. So each time you get a problem, the episode time between is shorter, so the time between each episode of back pain is shorter, and the amount of time it takes you to get over that is longer. So it might have been 1 week to start with and you didn't have pain again for a year, and then it might shorten down that every 3 months you're getting pain. It takes you 1 month to get over because it's really knocking you. And what tends to happen in these situations is that you might not do anything specific, you might not have a new trauma, but you might find that it's something really innocuous, like you reach down to pick up something, you reach around to do this, you're reaching into a cupboard and your back goes, or you're picking up the kid and popping it into a cot, or you're shopping, just something that's a mundane everyday activity, and then your back's a problem. We tend to be a lot more thoughtful about doing things when we have a big 10 kilo bag to lift, or we're trying to move something from here to here. We tend to be quite specific about it. We tend to go, this is going to hurt, this is going to be a problem, this is heavy, I need to be aware. And so you'll think it through, you'll bend your knees, you'll hold, you'll basically prepare your body for it. Maybe you'll even brace your spine, turn and move whatever it needs to be. So the bigger things, the heavier things, we tend to second guess them, and we tend to actually be more aware. And what tends to throw us is that, this silly things like, a toddler comes and runs and jumps on you, or, you're jolted by the dog, you're picking up something from the floor, you drop the soap, or you drop something in the bathroom and you go to pick it up. And it's these incidental things that cause us a lot more issues. So from our point of view, it's basically you being aware of what's going on, but also being aware of what your body's telling you. So in the acute stage, if you can, and you do get acute back pain, go and get seen quickly. The body is very, very good at protecting you. So what will happen is the muscles will spasm, they'll tell you not to move, you'll try not to move, and then the healing process kicks in and it might start to feel better, or it might still stay sore. If you've hurt yourself and it's not settling very quickly, go and get some advice, because you'll find if you do the right things at the right time and you're moving your body in the right way at the right time, you're going to maximize the healing process. So you're going to maximize that repair time that's going on in that first 3, maybe 6 weeks before things start getting solid. Okay, so if you think of your ankle, you hurt your ankle. The ankle is then going to feel weak. It's going to, you're not going to like going over on rough ground. Your body's going to say, wear a good shoe. Don't wear, flip-flops. Don't wear, stilettos. You really want to do something that's going to protect the ankle. Stay on straight roads. Don't go on the beach. Don't go on uneven ground. Don't go on gravel, because your brain knows, ouch, that's going to hurt my ankle. The back kind of doesn't have as much of an inkling as that going on. It's just going to stay rigid and hold you, and you're going to be very guarded in how you move. You might walk around a little bit more like a robot. But in doing that, what the body's doing is it's splinting you. It's wanting to hold everything very, very rigid. And while it's holding everything very rigid, it means that your back's very supported and it's not moving around the parts that are sore. So how do you know what to do? Depending on what is the issue with your back, the management of a disc problem is going to be different to the management of a facet joint problem. It's going to be different to the management of an inflammatory problem, and that's going to be different to a management if you've strained a ligament, or if you've pulled your muscle or strained a back muscle. And they all test differently. Now, obviously you come in to see a physio and we ask you heaps of questions like, how did you do it? What were you doing? When does it hurt? What's the pain like? Where's the pain? What do you do that makes it worse? What do you do that makes it better? What can you do to help yourself? What are you avoiding doing? What are you guarding yourself against doing? What's the pain like? What's it like at night? How do you sleep? And the reason we ask all these questions is because the body's got a very definitive way of reacting to pain. It's also got a very definitive way of how it wants to help you. And in the case of back problems, it wants to splint you. Okay. Now, over time, we want to know what's the pain coming from. You guys want to know, what do I do to fix it? And the bottom line with that is you need to know what you've done. Okay. So just because your MRI says you've got some wear and tear here, and just because it says you've got a disc problem here, doesn't necessarily mean that that's what's causing your pain. So similar thing will happen when, people will say, well, I pulled my spine 5 years ago, or I had a disc problem 5 years ago and my back pain's come back and I just want to check that the disc hasn't got worse. If you're then subjected yourself to more MRIs, you might find that the disc has stayed exactly the same. There's been no change in the disc, but obviously your pain's increased. And what we then need to find out is what's causing the pain that you're in now. It's not the disc, because obviously the disc is stable. So unless you've re-injured yourself or had another issue, it's going to be how you're moving or what's going on, or the fact that things just aren't moving well, or you might be out of alignment, there might be a muscle imbalance, there might be weakness, there might be something else going on, it might be posture. So that's what we need to look at. And this is probably the unsexy side of back pain, is really just getting to the nitty-gritty of what's going on and what you're doing. And hence the importance of asking all those questions. So when it comes to pain itself, what we're looking at is irritability. We're looking at how sore is your back. So the scales of 0 to 10, so when we're talking about irritability, is not so much how much pain are you in, is it a 2 out of 10 or an 8 out of 10? It's how much does that pain change? How much does that pain change and influence what you can then do will determine how irritable your back is. So to make that into sort of simplistic sense, if you've got like a low level back pain, it's annoying, it's maybe 3 or 4 out of 10, it annoys you, you can do stuff, you can go and work in the garden, you can do whatever you want to do, but your back pain goes up to about an 8 out of 10. But if you go and sit down, by the end of the day, you've had a bit of a rest, or by the next morning it's back down to normal, your normal 3 or 4 out of 10. That's not what you call too irritable. It means that it's quite predictable. You can do certain things with it. Yes, your pain level goes up, but it settles very quickly. So an irritable sign or an irritable problem would be your normal level's about 2 or 3 out of 10. You go away and do your gardening and you go away and do whatever it is. Your pain level spikes to 8 out of 9 or 8 out of 10 again, but it takes you 4 or 5 days to get over. So it's taking you that long to recover afterwards. That's what we'd call an irritable sign. So that one there would be a lot more cautious, because we don't want to irritate it, because then we know you're going to be sore for 4 or 5 days. The first one, you're still spiking to 8 out of 10, but it settles quite quickly. So we know if we do something with you and it irritates you, you're going to be okay by the end of the day, by the time you've rested, or it's going to be back to normal levels for you by the next morning. So when we're asking these questions, we want to know your level of irritability, because that gives us a good guidance of how you respond if we do something, or if you do something that's likely to cause you a problem. Are you able to settle it very quickly, or is it something that's going to affect you a long time? This one here, we're going to be very careful with. Whatever we do with you, we're going to want to go away and check in and say, okay, how did you respond to that? And then we're slowly going to improve what we're doing day to day. This one here, if we're quite confident in what we've found with you, we might be quite happy to push you, because what we want to then do is try and get you moving and try and get everything quicker. This one here that's quite irritable, we're just going to be a bit more respectful of the pain. Doesn't mean we don't respect this pain, but it does mean that we know that you're in control of it. Okay? The other thing we want to know is your pain pattern. So basically what's going on with your pain. Is your pain a problem where you wake up first thing in the morning and you're really, really stiff and you can't move, but you have a hot shower, you're able to move, and then it gets going? Or is it that you're good in the morning, and then by the end of the day you're getting really, really sore, so you can go so far and then your back's just collapsed on you and that's it, you're done? And the difference in those is potentially the first one might be that you're just getting stiff and sore, the tissues have just got a bit organized overnight, they've just stiffened themselves up, you get moving, you get going, tissues are fine, everything works. Second one is where you wake up and you're pretty good, but you might actually be fatiguing, or you might be overworking, so a bit like a repetitive strain injury, or you're loading the tissues so that by 2 o'clock in the afternoon, your tissues have gone, yes, I'm just sore and I've had enough and I need you to rest now. So that's the difference in how we are then also approaching it. Is it a loading problem where it's like holding your arm out all day and then, 12 o'clock in the day, the tissues are going, hang on a minute, I've been working like crazy here and I'm getting really sore? Or is it, I'm actually just really stiff and you just need to get me moving and I just need you to move and then, yes, I'm good, let's go. So loading, fatigue, how your pain behaves on a day-to-day basis, how long it takes if you irritate it to settle, what type of pain you're getting. So if I'm sitting here and I'm supported, I'm good. But if I try and bend, I might get a sharp twinge. And that might be, oh, there's a bit of pressure on the joint, in which case I know I might have a joint problem, or I stretch and it feels better, in which case when I compress things, it's different to when I stretch things. So we know we ask a lot of questions, but the reason behind it is because your body is telling us a lot of what it needs, and you know a lot of what your body wants. So what would you normally do to make it better? Do more of that. What do you normally do that makes it worse? Do less of that. And does that mirror and take a picture of what happens if you have been diagnosed by somebody and somebody has said, yes, you have a disc, you have a facet joint, you have a this, you have a that problem. So hopefully that makes sense a little bit. I'm just going to make sure I have a little bit of check. So pain itself, there's different types of pain you can get. So we can get sharp pain. Now, sharp pain might be when we pinch something. So that sort of nerve, if it's pinching, you might get a sharp ouch. If your joint's a bit irritated and we squash it, you might get an ouch. If you're doing something where you twist and you might have a ligament problem or like a muscle tear, you might get a sharp start of pain. You might get a stabbing pain. You might get a dull ache, you might get throbbing pain, you might get sort of inflammatory, so that it just feels hot and swollen and it's throbby, and that tends to be a little bit more noticeable at night. You might get a pain that's a stretch pain, so you move and you go, oh, that just feels like it's really sore, and it feels that it comes on when you stretch. But when you go towards that side, it doesn't bother you quite as much. So again, we're looking at, is that a soft tissue problem where we're stretching the soft tissues and it hurts, but it doesn't hurt when you squash the soft tissues? Or is it more a joint problem where you squash it and the joint gets compressed and that hurts? But if you open the joint, it feels better. So again, a lot of the tests that we're doing are really trying to differentiate between a joint problem, come a nerve problem, come a muscle problem, come a ligament problem. Okay. Nerve issues, neural pain. Most people can tell the difference between neural pain, and there's definitely a neural pattern that we'll go through. So for argument's sake, with the sciatic nerve, it's coming out from the lower areas of the lumbar spine, so the lower vertebra of the lumbar spine. The nerves come out, they pass through and through the muscles in the bottom, so it pierces through the piriformis, comes down the back of the leg and it splits at the knee. What we're doing when we're testing these is testing your neural tension. So when we're doing the straight leg lift and we're moving the leg, and we're just basically trying to test which section of that nerve is a problem, because mobilizing or treating the relevant section of the nerve, if there's some stiffness or some tightening or some tethering along the nerve, can definitely help. Okay, so different types of pain give us an idea, and how that pain happens and occurs gives us an idea what might be going on in your body. Now, all of that is really about managing you. You have a trauma, you hurt yourself, something happens, you've got your inflammatory process, you've got your repair process, you've got your remodeling process. In that remodeling process, if at the end of 3 months you haven't gotten the body back to that sort of normal stasis where your tissues are moving freely, your tissues are strong, that's when your chronic pain, repetitive pain can start to be a problem, okay? And what most people don't tend to realize is that when we hurt ourselves and the body splints, the body's rigid, and if that continues, you lose how you move. So you lose what's going on in your flexibility. Your joints might become stiff, your muscles can become tight, you can even alter your posture. And this is the little bit of factors that influence back pain that I wanted to really get to with you guys today, is to raise your awareness of what you're doing and how you move that you have control over, that can influence how you manage back pain. And it's one of the big things that affects how people get long-term management. So if you've hurt yourself or you've done something, or you've had that insidious back pain where it's like, I don't know what's going on. I've just started getting back pain and now it's chronic and I don't know and I don't understand why. It's just happened. Sometimes that can be what we just call like a postural dysfunction, or it's a biomechanical issue where over time the body's just adjusted and the body's just changed how it's moved to the point that where it sits now causes pain. How would you sort of look at moving? It's really, if you think of the body as a machine, if you think of the body as a car, if you're looking at a nice, pristine, brand new car, you look after it, you check the oil, you check the water, you check the tires, you do the realignments, you can keep that car going forever and ever and ever. Yes, it's going to start to age, but if you're one of these people that's, you looked after your car, you've kept it in the garage, you top up everything as and when you should, it's still going to look quite good after being 20 years old. Now, if you're somebody that's ran your car ragged and, you've just thrashed it, you've not checked the oil and water until the lights came on, and you thought, I need to do this, and then your tires have been starting to wear out, but you changed the tires, haven't done the realignment, you've had sort of a few things, you leave it outside, your car at 20 years is not going to be in as good a nick as the car that's been garaged and well cared for. And sometimes that's what happens with our bodies, because when we're 20, we're infallible. We can do everything and everything works. I'm an ex-skater, so I spent from being 6 to 21 doing artistic roller skating, which meant 4, 5, 6 times a week, training, falling on hands, falling on bottoms, falling on backs. You fall on concrete, and that's really not kind to your body. You don't see that when you're 20, when you're a teenager doing stuff. Same thing if we're doing sports and we're doing activities and we're doing whatever we want to do. In those days, the body bounces back. So, we've got lots of collagen, the body can repair itself a lot more quickly, the joints have got a lot of space in them, and everything just moves. Once we start hitting 25, 30, we're losing some of that collagen. So the structures that give us our sort of flexibility and they give us the ability to move freely and easily, we're losing some of that. Certainly, in the face, we start getting wrinkles, we start getting grey hair, we start getting a little bit saggy, and the natural aging process takes over. Now, there's that natural aging process that happens in the tissues as well. So if you've been told, look, you've just got arthritis in your back, you kind of would expect arthritis in your back. It's a natural part of aging. The discs get a little bit drier than they used to be, so they're not nice and plump, same like our cheeks, we're not nice and plump, we've got a little bit saggy. The discs are the same. The tissues, when we're moving them, we don't have, we feel a bit stiffer in the joints as we get older. Everything sort of starts to creak and ache a bit, and we have that same aging process going on with the tissues underneath. So, if you do have pain or you do have injury, and going back to the car analogy, are you taking on board what you eat as something that is, helping you? If you have an acute injury, are you looking at food that might help you? Are you taking, something like an anti-inflammatory or painkillers that will then allow you to move within what you've been advised to move, or are you eating like junk food, which we all do, but are we eating stuff that is not going to be very, very good for our healing process? So some people who are very up on this will actually say, okay, I'm going to take things like turmeric, I'm going to eat a few more red berries, I'm going to try and get some antioxidants in them, I'm trying to get, things like pineapple and what have you that might have an anti-inflammatory effect, but it also helps with your healing. That's one area that we can look at in terms of, if you go out and you exercise and you are doing things, are you looking at carbohydrates and things before you exercise that can give you some energy? And are you looking at something like proteins and things that will help you repair once you've had exercise or once you've finished exercise? So, these are a few things that we can look at. And if you're interested, go and have a look on the internet. There is heaps of information. I am by no means a dietitian or nutritionist or up on, what you shouldn't eat or what you should eat. However, if you are interested, there's definitely heaps of info out there for you. In terms of the body itself, if you have chronic ongoing pain and you look at how you move now, it is most likely to be quite different to how you moved pre-injury or pre-pain. So what we tend to find is that when people do have a problem, how they're moving now is definitely restricted or definitely different or definitely stiffer or definitely more cautious. So what I will generally do when people are coming in is ask, how are you moving? Are you in pain where you are guarded? So if somebody was here, would you just rotate around like this, or would you turn your whole body? If you're going to pick something up, are you happy just bending and picking it up? Or do you think, okay, I'm going to pick something up now, I need to brace and breathe and then do it? If you have to put on your shoes and socks, are you happy standing on one leg and doing it? Or do you do it where you put your foot up so you're actually supported and you keep your back quite rigid? When you're sitting down, do you have yourself here or do you lean to one side? And what we'll tend to see is that there's definitely patterns that go on. So a few things that it might be worth looking at if you don't look at this, because a lot of our clients, and we're in a very rehab orientated. So when you come in to see us, we want you to get better. We want you to improve. We don't want you coming in for passive care. We don't want to say, yes, we can fix you. We can fix you. But we don't want to come in and say, look, we can fix you. We just need to do this, 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 and this, and then go away. What we want is you knowing what happens, you knowing what to do. So if this happens and you get pain here, you do this. If this happens and you get pain here, you do this. You don't need 20 lists of things to be able to do. You need to know, this pain is me loading it. So I've been on my feet all day and it's sore. So I've been walking all day and my back's really sore because I tend to walk like this, and my body just wants me to bend forward because it wants to open things up and it wants to stretch. So something like putting your foot up can just help relieve that pressure. So if you're here and your body spends all day being compressed and you're leaning backwards because you're in the sway posture, you might find that what you want to do is relieve it by here. Now, if you are sore and you're compressed and you're sore, I see a lot of people then making it worse by trying to do this and then wondering why it's still sore when really they need to do here. And then they'll go back to leaning straight back on it. And then you want to relieve the pressure again. And then you go back to leaning back on it. So it's understanding what's going on with you and understanding what's going to help. So what are you getting pain with now? What do you do during the day? So write a list, go, what's my normal pain? What level is it on a 0 out of 10? What am I doing that makes it worse? What am I doing that makes it better? Is it worse in the morning, the afternoon, or the evening, or is it worse at night? What do I do naturally? Do I Do I want to stretch? Do I want to do this? And it's just take notes over maybe 3 or 4 days and say, okay, actually, I'm tending to stretch that way and I'm tending to be sore when I'm on my feet a lot. And when I think about that, I'm squashing things and it hurts. And then when I stretch things, it feels better. Then, you sort of got a bit of a compressive problem. And then, actually, maybe when I'm about, what I need to do is same as I've just said, put my foot up, or I need to be on a chair and just perch just to take some pressure off. Or if I'm on the shopping trolley in the car, I just need to rest my feet on the shopping trolley, or I need to rest on the counter so I just take some pressure off. Because what we want you to do is manage your pain better. If you're constantly irritating it and constantly scratching it and constantly making it worse, you don't give it a chance to heal. So what is causing my pain? What is causing it when I get pain? Second thing is, so that's looking at your posture. That's looking at positions. That's looking at your pattern of pain during the day. That's looking at the type of pain you're getting and just see if there's a pattern. And if you actually stop and listen to your body and maybe even ask, what does my body need? What's my body asking for? Does it want to lie down? Does it want me to stretch? Does it want me to move? Does it need heat? You might find that you've got some answers there because you do them naturally. If you've had back pain, the body splints and it goes into spasm. And when it does that and it holds everything rigid, which it's really, really good at, we lose 3 things. We lose mobility. We have muscles that are in spasm and they're holding everything rigid. And we have other muscles that stop working. And this is what happens when people say, I've got a weak core. So we have our postural muscles that support us. Our core is the muscle at the front. So it's our tummy muscles. So our deep, deep muscles of the tummy, which is our transversus abdominis. We have our diaphragm muscle, which obviously sits under the lungs. We have the muscles and the fascia of the back. So the multifidus and thoracolumbar fascia. And then underneath we have our perineum, so our pelvic floor. So if you think of that as like a cube, when you stand and when you do everything and you brace, you actually encourage all that tightness to come into the back and you encourage everything to be rigid. And what happens when you're bracing and being rigid and breath holding is that all those big muscles that are splinting you just get stronger and they just get better at splinting you. And all those core muscles, the deep muscles that want to try and support you, they can't do their job. And so your postural muscles and your core muscles basically hold you height and tall and allow the body to move. Okay, so they separate the spine, so they give the spine a bit of stretch and they allow you to move. Now what happens with those big muscles that brace you is they compress and they squash everything. And not only are they then holding you up, which isn't their job, they're then also trying to move you. So you're moving muscles that should move your chest and your trunk and your legs and everything else, and they're working hard to hold you. So they're doing 2 jobs and squashing the spine at the same time and making your core muscles even more inhibited or even more weak. So that tends to be a big problem when people decide that they're going to go and do some exercise, because then when you go and do exercise, what you're then doing is making those muscles stronger and making the core muscles weaker and compressing even more. So you'll see this when you go, okay, I'm going to go and do some core work. I'm going to go to just heard that, moving is really good for my spine. And you go and do boot camp or whatever, or running, or whatever exercise you want to do. But what happens is you can do 1 or 2 sessions, but number 3 session, you just collapse and your back gets worse. Or you can do this, or you can run so far, but you can't run any further and your back gets worse. So we tend to see it that you get so far and then you push those muscles too hard and then that's it. So you can just go so far, and trying to do that extra bit is too much. You might also find that it's really hard because you're working hard, so you fatigue a bit quicker. And that tends to be because you're overusing those big muscles to use them as a support structure and then also use them to move you. And they can't do both jobs. And if they do, they don't do both jobs well. So we need to redress how your core works. Definitely if you haven't been working your core properly. And we look at core as being able to support your spine without that compression. Okay, being able to support it so it can then move. So it doesn't mean lots and lots and lots of sit-up. It's more about control and stability and everything else. So then you can then use those big muscles to help you move. So hopefully that's made sense. So we've got what's your pain coming from and what can you do that makes it worse, better. Also, what muscles are you using day to day? Are you using your big muscles that are then causing more problems and more fatigue and more compression? And have your core muscles switched off, okay? Now, when you have weak core muscles, you're also going to have weaker pelvic floor muscles. So more sort of prevalent in females because we generally have a little bit more issues pelvic floor wise, not saying that men don't. But what you'll find is you'll sneeze and you'll cough and you might cross your legs. You might find that if you have got a full bladder, you want to go to the toilet a bit more frequently. You might find that you've got a little bit of urgency. You might find that if you go in on the trampoline or you don't trust yourself and you might have an accident or you might feel that you're about to. So your core muscles and your core strength is very much tied in with how strong or effective you feel your pelvic floor might be. Pain isn't normal. We don't have to put up with pain. Weak pelvic floor isn't normal. You don't have to put up with a weak pelvic floor. There are heaps of things you can do about it. And what most of us don't realize is that just how we hold ourselves and how we move and how we do things is basically on a day-to-day basis compounding that problem all the time. So pain, core muscles, big back muscles, so we're talking about your quadratus lumborum, we're talking about your piriformis, we're talking about your erector spinae, we're talking about your lats, we're talking about your hip flexors, all overworking to cause the spine to compress. And if you're already irritated and you're already sore because you're here and you know you're already sore, if you then squash down and hunker down, it's going to get sore a lot more quicker, a lot more quickly rather. Altered posture. So if you're sore in your spine and you've hurt it, you're going to change how you move because you know, actually, if I do that, it hurts. So you might find that when you're standing, you might find that this side hurts. So what you've started to do is lean away. So when you've got weight on two legs and you stand nice and straight, this side of your spine hurts, so we start leaning away. We might start just taking more weight on that leg. We might feel that we twist a little bit, okay? And then over time, that becomes normal. So when we're standing, we're actually standing off center. So this is me straight. This is me still kind of straight, but I'm trying to take weight away. So if I'm straight, this hurts, I'm going to lean away. Okay? Now, over time, these muscles are going to want to work because I'm going to fall this way, so they're going to try and work to pull me back. This muscle is going to get short because it's getting pulled this way. Okay? Also, the same thing will happen in the front. I'm on that lean. So these muscles in my obliques here are going to get stretched. They're going to work on length. These muscles here are going to be relatively short compared to here, So then these muscles are going to need to work stronger to pull me up. So when we're looking at clients, we're saying, well, this muscle's actually working really hard and it's tight. This muscle's working really hard, but it's on a length and we need to get it working more efficiently. Okay? So it could be that it's just hanging It could be this one's tight and it's too rigid and it just doesn't move. So we're looking at, from a posture point of view, not only where's your body and how does it sit, but also have muscles accommodated and stretched to allow you to be there, and have other muscles accommodated and got short to hold you there, so that when you try and stretch this way, you just can't move. So if you're in class or you're doing something and you're this way on, you might find it's really easy to mermaid that way and stretch, but you might find actually it just doesn't go. It feels really rigid and it just doesn't move. And you might see that in cupboards. You can reach into that one, but you can't reach into that one. You might see it if you reverse in the car. You can reverse that way, but you can't reverse that way. Okay? So we're looking at altered posture, having a knock-on effect where tissues get tight on one side and short, and tissues get long on one side and maybe weak because they're just hanging and they haven't been able to work into their normal position. Okay, so muscle imbalances can occur. So you might have strong muscles, you might have weak muscles, you might have muscles that are working, muscles that have stopped working so they've become inhibited. You might have muscles that are very short, or you might have muscles that are long. So in terms of the muscle, it could be long and weak, it could be long and strong, it could be short and weak, it could be short and strong, it could be shortened from the point of view that it's lost flexibility, or it could just be working in a shortened position. And these are all things that you need to think about. So if you've had that on long-term ongoing pain, if you fix the pain and you get you do your massage, or you do your trigger point work, or you do your heat, or whatever it is that helps you, and you go, oh, that feels so much better, and that feels better for the rest of the day, and then you wake up the same problem again. It's because you've gone back to either stressing the joint, so it's on a stretch, or you're compressing the joint, or the muscle's working too hard, or it's not working at all. You haven't fixed or addressed the background factors that cause back pain. Okay, so let's go and check where I'm at. So we've talked about acute pain. We've talked about chronic pain. We've talked about how things move. We've talked about how things can stay rigid. So when we have that chronic, everything stays stuck. When everything is not moving well, we have altered biomechanics, and that can show as poor posture, altered posture. We're slightly shifted, we're slightly rotated. That has a knock-on effect where some of the joints might get compressed more, some of the joints might get stretched more. We then have the knock-on effect of muscle imbalances, and those imbalances can be some muscles are weak, some muscles are strong. It could be some muscles work too hard, some muscles don't work at all. It could be some muscles are inflexible because they've become stiff and short. It could be some other muscles are working massively on length. So biomechanics will generally change. And we really need to know what's happened with those biomechanics to alter it. So if I'm working, moving, doing everything, and I decide that I'm going to manage my pain and I'm going to do 10 stretches at night that, make me feel better. So I'm doing my 10 stretches at night, or I'm doing my 3 exercises at night that I think are going to strengthen me. And then I don't think about everything for the rest of the day, and then I do my 10 stretches at night, and then I go back and do my own normal thing at the end of the day. It's going to take a long, long time for you to outweigh what you're doing 24/7 by doing 10, 15, 20 minutes of something at the end of the day. And where you need to think about your strategy, and it's where we're very successful in what we do, is that we're asking you, where are you now? Where do you want to be? What is it that your body's capable of now? What do you want your body capable of here? And then we're looking at how do we get you from here to here through what's your pain? What's it doing? Where is it coming from? What can you do that makes it better? What can you do that makes it worse? So we know what's going on first. We test that out and go, okay, we know what's going on here. Now what are you doing day to day? How are you moving? What's your muscle strength like? When you're static, how does that compare to when you move? So when we're here, we might say, okay, our posture's good and you look pretty good, but when you walk like this because your hip hurts so you don't want to take weight on it, or you're standing but you walk like this, or you walk like this because your hips are tight. So how you're then moving and the muscle imbalances around that is going to play a much bigger role 24/7 than what you do for 10 minutes at the end of the day. And it's going to be much easier for you to manage your pain if you know it's a compressive problem, that you take pressure off it. Actually, this muscle is weak, so I need to specifically strengthen this muscle, but this muscle's too strong and it's causing me to pull that way, so I need to release that muscle. There's no point strengthening that muscle if you don't release that muscle, because this weak muscle can't fight that muscle. There's no point releasing that muscle and not strengthening that muscle, because you release it and it's just going to go back to square one. But if you release it and strengthen this so it can hold it, then you've got both sides of the argument addressed. And this is where looking at you and you looking at your body as a whole is going to make things a lot more effective for you. There's numerous different factors that influence how your pain comes on. There's numerous different factors that influence how you move. There's numerous different factors that influence how you're going to respond to things. And you've got to pick the right ones, and you need to target the right ones, because targeting one when you've got pain, but also posture issues and a muscle imbalance issue and a muscle weakness issue, and the fact that, you know, you're doing things during the day that actually create problems or create more of what we don't want, if I phrase it that way, is going to be a lot more of a longer road than you understanding, actually, I favour my left leg all day. So I'm standing and I'm here all day. And then I wonder why this hurts. And I wonder why this muscle hurts, because this muscle's trying to pull me backwards and this muscle's getting squashed and this joint hurts. So when you understand that, instead of just releasing that, you might go, actually, I'm going to release this, but then I'm actually going to strengthen this. So when I'm standing all day, I'm more likely to be here. And then I'm going to strengthen this bit so I'm supported rather than being here and here. Okay? That means that whatever management you do, it's going to be far more effective. So I think I've been on a little bit over an hour. It is a topic that, you know, we can talk about. So hopefully that has given you a little bit of insight into what you're doing. Basically, the long and short of it is if you have acute pain, then if you are in pain where it's, you know, I've hurt myself and I'm not happy, go and get looked at quickly, because you want to maximize the way that the body can heal. You want to maximize and use those processes to your advantage. You don't want to be, my back's sore, I can't move, let's just wait, because the first 2 days are going to be inflammation. The second little phase is going to be your repair, and then it's going to remodel. And it's exactly the same as an ankle problem or a knee problem. It's still soft tissue. You want the body repairing in a way that it's laying down its repair tissues optimally. You don't want it to go into a massive bundle of scar. You want it to go where it's laying things correctly, so it's lining up. And we're using mechanical stress to make sure that your tissues then work well. If you just do nothing, you go into spasm, certain muscles switch off, certain muscles work more, you alter your posture, you're altering this, the pain might go away, but then you're still moving not optimally. And then further down the track, things are a little bit stiffer, things are a little bit weaker, things aren't working as well as they used to, and you get pain again and you don't understand why. So the biggest mistake, or the biggest sort of upset that we see, is that people go, I've hurt my back, I'm just going to have back pain forever now. And that is completely not true. You can become pain-free. Yes, there is an area there that's a bit dodgy. If you do something stupid, yes, you might get pain. So we might have, clients that come in and they've hurt themselves and they get pain. What we want you to do, though, is normally you'd get pain and it takes you 3, 4, 5 weeks to get over. We want you getting pain and you're over it in 2 or 3 days, because you know what's going on and you know what to do. You irritate it and you go, yep, my back just normally goes into spasm if I do too much. This is how I release it. This is how I stretch it. This is how I strengthen it afterwards. And then your recovery from each episode is shorter, rather than the normal process, which is it's longer and it takes longer for you to get better. Okay. Obviously, if you do something stupid and you hurt yourself and you've got an acute injury, that's going to be a little bit different. But most people that have that sort of chronic ongoing, I get pain every now and again, I have a flare-up every now and again, instead of it taking 2 weeks, you want it better within 2 days. Instead of it taking a long time to get it better, you know what to do straight away. When it doesn't work for you, that's when you come and get help, or you go and get help and go, you know what? It's helped a little bit, but this still feels like it's stiff and it feels like it just needs a little bit of hands-on. Great, we can do a couple of sessions and then it gets better, and then you improve and you go back to your normal management. What tends to happen when people aren't managing their pain well is the spiral goes this way. The pain stays and it gets worse for a longer period of time. So where you'd normally get better in a week, takes 2 weeks, or it might take 3 weeks. Where your episodes normally take 6 months apart, they get 3 months apart, and it gets shorter till one day you can't remember when you're pain-free. So probably that's one of the reasons I've done this live or done this chat, is that no one deserves to be in pain all the time. There's multi-factors that need to be looked at when you have pain. It's not just pain. It's not just how you move. It's how that relates to you as a whole. What are you doing day to day? What's your posture doing? How are your muscles working? When you move, how are you moving? Do you move your muscles effectively? Have you got certain muscles that are too strong, fighting against muscles that don't work? Have you got muscles that don't work so they don't support you? They're all things that will influence how your body uses your muscles, how your body moves. But at the end of the day, how you function and how good that is at you being able to get less pain or more pain-free. And if you're not addressing that and you have a tight muscle, it's not going to move, because you can't move against something that doesn't move. If you've got muscle spasm and you're not releasing it, that muscle spasm is going to cause pain. If you've got muscle spasm because something else isn't working, it's not going to let go because it's the only thing holding you up. And if you release it and you don't fix that, you're going to collapse. So, like I say, from my point of view, it's quite frustrating. Knowing people are trying to do the right thing, but not quite doing the whole picture. So let me know how you've gone with all that info. Like I say, it's been a bit of a long chat, a bit of a long spiel. I haven't had any specific questions apart from what do I do from acute back pain compared to chronic back pain. In the acute, so think of the acute really as 0 to 6 weeks. Get looked at quite quickly. Get somebody who's going to help you, and it makes sense. Definitely for our clients, if you can make sense with what you're telling somebody, they will definitely then improve, because you're buying into what you're being told. So, if somebody's having an issue and we can explain to them why they're having that issue, and we can explain why that issue is then causing this, and you understand that, that's going to have a whole lot more benefit for you than anything. So if I'm looking at my pain here, and when I stand here, it's okay, but I'm standing here, and this is how I stand all day. I still look relatively straight, but you can see if you look at me, this is straight, this is a slight shift. I'm going to get pain here, and I'm going to get pain on this joint here because it's compressed. And if I explain to somebody, that's going to hurt you all the time because you're just squashing it. It's like holding your finger back all the time and it's holding it. Can you feel all your weight's in your left leg rather than being center? And then it might be a light bulb coming on going, oh, actually, I do that all the time. I stand like this, I stand like this. And if I'm on the couch at home, I sit on the couch at home and I've got my pressure this way. So everything they're doing loads that side. And then you realize, well, actually, yes, I'm putting pressure on that joint all the time. So if you can maybe learn that what you think you might be doing to help might, or what you think you do day to day isn't influencing you, have another look at things and see if it is influencing you. Because our job is to help you, and our job is to get you improved, and our job is to help you stay improved by giving you what you need to do to stay better. And part of that is you understanding what you're doing day to day and what you're doing 24/7 is going to have far more influence on what you do than what we do with you if you're coming in to see us twice a week, 3 times a week for 20 minutes, 40 minutes, an hour, whatever it is that your normal standard appointment is with somebody like me or somebody like Chiro. If you then go away and do something that's completely the opposite, then you're going to end up with pain that's not improving, and you're going to end up having to get that maintenance therapy all the time because you're not doing anything that holds you in that better position. Somebody puts you here and says, yep, that's good. And then you go, great, feels great. And then you go back here again. And then you go, God, that's sore. And so you go back and you go, yep, that feels better. And then you go back and you go back to normal. We need to change what you're doing on a day-to-day basis to help you get that long-term benefit and help you get that long-term result. So hopefully that's helped you. Hopefully that's given a bit of an insight. I've got these stupid earbuds in that make you sound like you've got a bit of an echo. So it feels like I'm talking through cotton wool at the moment. If you're interested, we do see people. Obviously we see people. So we're based in Hillary's in WA. If you would like to come and see us, then feel free, flick us a message. If you're interested in some of our programs, we are starting an online back school program, which is aimed at me talking through what we've just talked about, but on a week basis. So 1 week we'll talk about posture, 1 week it'll be different diagnoses and what they mean, how they present. 1 week it'll be on how you can stretch out certain tissues, how you can strengthen certain tissues, how you can change your posture, how you can change your flexibility, and it will be over an 8-week period, and we start that at the end of March. At the moment, until the end of February, it's just 444 Australian dollars. I'm trying to keep it nice and simple and easy for you, so that if you wanted to come on board, it's basically very, very user-friendly and very, very sort of minimal cost compared to seeing us in person. Ideal if you have sort of those ongoing niggly pains, you think, look, I'd like to self-manage, I don't really need hands-on, I don't really want to see anybody, but I'd like to self-manage. And you've got that sort of niggling, maybe 3 to 6 level pain that is, you know, I can, whatever I do, it's non-irritable. It's if I do anything that makes it sore, it settles quite quickly for me. It's just that standard pain. So if you're interested in that, our back school program's got 20% off at the moment, which is, like I say, 444 Australian dollars until the end of February. I'll put the link at the bottom of the video if anyone is keen, or feel free if you have a question or a comment or anything that you would like answered, feel free to drop that into the video as well, and I'll do my best to help you. Like I said, the aim from my point of view is really just trying to get the message out there that you don't have to live in pain. We don't have to be in constant pain all the time. There are things we can do, and if you do have pain that's there all the time, maybe we can change the level of it. So instead of it being 6 or 7, it can come down. Instead of you getting pain by 2 in the afternoon, maybe it doesn't come on till 4. If pain wakes you up, 5 times a night, maybe it just wakes you up once, so that you're changing the level of pain. So many clients have come into us and said, look, I've been told that I've just got to give up sport, I've just got to give up this, I've got to stop doing this. And pain shouldn't stop you living. Pain shouldn't be a sentence for you that you have to give up everything and just put up with it. We can learn to move differently or change what we're doing so that we alter how it affects us. And that's really where I want to come from, because, we have been able to change so many lives. We have been able to transform people's lives because we're looking at it from a multifaceted point of view. Instead of saying just do this, it's like this and this combined with this and this and this will give you a whole and a holistic management structure that you can then use. It doesn't mean that you're doing, half an hour at the end of the day. It does mean that, if you're at work, you might need to stretch and do something here. It might be that you answer the phone and you might stand up and walk around the office to answer the phone. It might be that you're doing a computer program and you go, okay, I've changed programs, I need to sit back in the office. It might be that you need to put your foot up on the stool. It might be for you that every half an hour you need to stretch. You're generally being pulled this way, so we might say, look, your thing is that you need to stretch that way. It might be that you like this side of the couch all the time. So it might be that, in the commercial breaks, you stand up and you sit on the other side of the couch between, 2 minutes. It doesn't have to change huge amounts of your day. If we can just do tiny little bits that are inobtrusive, the results that you get will skyrocket, because you're changing things minimally. It's that little and often is going to have far more impact than 20 minutes at the end of the day. So if you've made it this far, thank you so much for your time. Thank you for taking the time to watch this far. We're an hour and 20 in, and hopefully you might have got something out of that. So feel free, if you would like, flick me a email, info@thecoreexpert. If there's anything question-wise, feel free, tag me if you can, so I see it. And hopefully you might have learned something. Take care.